Hi there. So many of you are probably well aware by now that there's a global pandemic, the coronavirus, and there are obviously a lot of health concerns, but also potentially some opportunities for investors. And we wanted to kind of go through that with Tom Carroll, our senior analyst and also healthcare guru at Stansberry Research. Talk to me about the kinds of categories that you have sort of established within healthcare when it comes to investing and how they could be impacted by this epidemic.
Yep, absolutely. So healthcare is a big world, right? And it's a complicated thing. I tend to think about it in 6 buckets, right, when you're thinking about healthcare. So first of all, we've got doctors and hospitals. I call them the providers, right? And then there are the insurance companies, managed care organizations, or MCOs. Those are the companies like United Healthcare and Aetna, some household names. There are the life science companies, right? And life science is also a bucket where I would call it, what's inside there. It's everything pharmaceutical and biotech, those vaccines, those types of things. You also have medical device companies, right? The companies that build the hardware, the knee implants and the hip implants and all the little devices that help us and help surgeons in the hospital.
And this could be a ventilator, something that people use in the hospital.
Absolutely.
Okay.
Then you have what I would call the medical distribution companies, right? So these are the companies that aggregate all the supplies. So thinking about walking down a hallway in a hospital and all the stuff you see, they have to buy all that stuff from somewhere. And so a company like Cardinal Healthcare is an organization that buys all that stuff and resells it to the hospitals and physicians' offices as well. I'd also throw into the mix healthcare IT companies, kind of as a last bucket, right?
Okay.
So and this has been kind of a relatively new sector
Does this include
categorization.
Labs?
No, this doesn't include labs. Labs is kind of on the fringe. You could put lab companies probably in the provider bucket, right? So an organization that is providing either direct patient care to the patient or some type of service on behalf of the direct caregivers.
So how does coronavirus impact these buckets? Let's kind of take them one by one. Let's start with providers, for example.
Yeah. So on the provider side, I think we would have, you're certainly going to have more people. Let's assume that it becomes a huge pandemic in the United States and there's tens of thousands of people. You're going to have those tens of thousands of people seeking care probably within a hospital setting. I don't think from a financial perspective it's going to be all that great for hospitals, right? Because these patients are mostly just receiving palliative care, right? And so for hospitals really to survive, they need more invasive procedures. They need surgeries. These drive higher reimbursement rates for the hospitals. Back when I used to study these for a living on Wall Street, hospitals used to say they really didn't like the flu, which comes every year, because the flu puts a patient in a bed, but it's mostly just a patient that is getting hydration, that is getting monitored, and then they're sent home. So from a provider perspective, financially speaking, I don't think it's going to be all that great.
What about managed care companies, the insurance companies? So if it's not good for the hospitals, it may not be good for them either.
Right. So there's a nuance to this, though, right? So managed care companies are the ones that have to. So all those people going to the hospital need to get paid for, right? So the managed care companies are the ones that pay for that care. But if we have a massive outbreak of coronavirus in the United States, guess what? People aren't going anywhere. They're going to stay at home. They're not going to necessarily seek services. I mean, the folks that do go in the hospital will have to get paid for it. But again, remember, I said it's not that great financially for the hospital. So the managed care companies may see higher costs going to this, but it's more utilization of a smaller cost bucket, if you will. So kind of paradoxically, I think the managed care companies could actually do quite well. And I'll tell you a quick little story. So 15, 20 years ago, there was a subset of managed care companies that came out of the woodwork called the Medicaid HMOs. And they basically didn't work with employers like Stansberry or General Electric or IBM to provide health benefits. What they did is they went to state Medicaid programs and they said, we will manage the health care for all your Medicaid beneficiaries. And Medicaid is the state and federal run health insurance for the poor. And so back in, I think it was 2005, there were 3 big hurricanes that hit the state of Florida from all different angles over a period of 60 days. And what we saw was the big Medicaid companies that worked in the state of Florida in that Medicaid program actually saw their earnings go up in the 2 to 3 quarters
because
following
there was more usage.
Because people stayed home, they did not go and seek care.
Okay.
Now, what we saw is about 10 months later, costs start to go up.
Okay.
But in the near term, those stocks actually performed very, very well. So kind of a nuance to, and again, another example of how healthcare is complicated, and one of those interesting characteristics that, you really, in order to invest wisely in healthcare, you have to really know about all parts of the system. So I think managed care companies, at least in the nearer term, if you will, between kind of 6 to 18 months, are probably winners.
Okay. What about life sciences? This is probably the easiest one to answer,
Yeah,
right? Because
right.
we've already seen Gilead go up and other providers of vaccines.
Yep. So that's it's not nuanced, right? It's fairly easy to understand, So you've got companies out there now that are trying to develop a vaccine, right? Looking for something new to create. You've got companies also that are taking and kind of surveying all the therapeutics and stuff that's already out there to see what may work against coronavirus or what combination of drugs might come together. And those are, there's a ton of them out there, right?
So this would be anything medical, anything vaccine. This whole bucket is probably ripe for the picking.
Yes, so you mentioned Gilead. I'd also mention Glaxo. Pfizer has said they're looking to jump into the actual creation of a vaccine. So these are organizations that will see some type of uptick. But then you have to ask yourself, these are big companies, right?
Yeah.
And the coronavirus is just a tiny piece of it. So I guess in the near term, you could see the stocks move related to this very small component because it's in the news, it's on the headlines.
Yeah.
But it's really hard to hang a hat on a longer term thesis with coronavirus relative to the life sciences companies.
Okay.
So more of a near-term benefit there, in my view.
Okay, what about the next bucket?
So like medical devices, distribution, healthcare IT, really kind of neutral. I don't see much impact directly on the businesses of those companies.
Okay.
So really, to me, the winners here are the managed care companies and the life sciences companies. I think the losers in the near term are the providers, the hospitals. Again, speaking from a financial perspective.
Right. And speaking from a political perspective, we obviously just had a big vote in Michigan last night in the Democratic primary, and you have a lot of interesting thinking on how stocks in healthcare are impacted by who's ahead in the Democratic primary.
Yeah.
So based on last night, obviously we saw Biden sweep a lot of the Midwest and leave Sanders behind. How do the markets and how do healthcare companies sort of see their potential candidacies?
Yeah. So if healthcare is not hard enough to understand and invest in, right? We got this coronavirus thing going around. We are also in, there's a bigger, broader theme this year, right? And that's the election. And I think that healthcare is going to be, if not the deciding factor, one of the top 3 deciding factors.
Oh, I think the polls bear that out.
So,
it's what people are voting about.
Yep.
Sure.
And I think that smart money in healthcare is not looking near term at coronavirus.
Okay.
I think they're looking more at what is the next round of healthcare reform going to look like, and who are going to be the winners and losers out of that, right? The last time we saw this was really in 2008 with the headlines around the Affordable Care Act, AKA Obamacare. We saw it in 2010 when the law was actually written. We saw it again in 2012 and 2014 when the law started to actually get implemented. So we actually wrote a digest about a month ago on which of the candidates would be good or bad for healthcare stocks, and I tend to think of course, we've got fewer of them now.
Right, a lot fewer.
but like a Biden and a Buttigieg, again, not in it, and a Trump, generally speaking, should be more positive for healthcare stocks, right? Because they are supportive of the law of the land today, the Affordable Care Act, right? Keeping in place. Trump, talks about hating the Affordable Care Act and Obamacare and wanting to get rid of it, but any solution he comes up with is probably going to be, it won't be called that, but it'll probably look a lot like the Affordable Care Act. So that kind of keeps everything status quo and in place. And I think, Biden will look to actually support the Affordable Care Act and make it better over time. Yeah. The others, Elizabeth Warren and Bernie Sanders are talking about Medicare for all and single payer system. I just think that's, certainly if we were to flip to that, it would be very bad for healthcare overall. But also I think just in the United States, that's not something that this country is ready for. quite yet. I think that we will move in that direction, but what we come up with is going to be something, I like to say, uniquely American. And I think it'll be a mix of, kind of private sector solutions backstopped by government funding and rulemaking, really, about what's out there.
But really what you're talking about is the healthcare system, and if you're investing in the healthcare system in light of all these politics, certainty and stability is the safer play. If you go with somebody who benefits from the stability, that's probably the better play.
Yeah, I mean, the Wall Street and investments hate uncertainty, right?
Yeah.
And you see that quite quickly. So I think generally speaking, actually when Biden did really well on Super Tuesday, all the managed care companies were up 14-15% that day. So it was actually, that's what we wrote the digest on.
And people can find the digest on Stansberry.com?
I believe so.
Okay.
Yep, it should be there.
We'll send them over there. Take a look if you guys are interested in deepening your understanding of healthcare investing, especially in light of the healthcare levers we're seeing right now. That would be a good place to go.